Hi, I'm Lynn Black. I'm a physician. I'm on the board of Last Mile Health. And full disclosure, I was a nurse earlier in my life, which trained me for all the work I'm doing.
And I'm Siobhan Kelley. I'm from Last Mile Health, and we work to partner with governments to build national networks of community health workers that extend the reach of the health system to the last mile.
I'm incredibly inspired to use the position I am in to advance the health care of women and girls. Having been a nurse before I became a physician, I've learned about the importance of all the models that take place in caring for people, and Last Mile Health saves girls and women in the most remote areas. And I'm thinking of Ruth Tarr right now. She's a community health worker from a remote village in River Cess, Liberia. She was recruited by us and then subsequently trained, equipped, supervised, and in her role, she actually takes care of her whole village, particularly women and children, and ensures that women get to facilities for safe deliveries.
And I think vitally for Ruth, she is paid for the work that she does. So she has a contract with the government of Liberia and is actually paid for her life-saving work. And she was invited by the World Health Organization to travel last year for 3 days from Liberia to Kazakhstan to go to the Global Conference on Primary Healthcare, where she helped launch the CHW guidelines. And as part of those guidelines, they say community health workers like Ruth should be paid for her work. And so we are inspired to help elevate and amplify the voices of female community health workers like Ruth who deserve to be paid for their work.
I think that is an incredibly important point that you're making. The payment of women for the jobs they are doing values the work they are doing. And what we're seeing now is this is a huge opportunity as governments have recognized the importance of this. And as you said, at the World Health Assembly, have stated the importance of paying community health workers.
Exactly. So we know that community health workers can not only save the lives of girls and their mothers, but they also are advancing gender equity directly in their own communities, which is wonderful.
So thinking about being a senior leader in this field, I think from the moment I realized I was a senior leader, I realized my job was to mentor the next group coming on. And so every woman I meet, I see it as my imperative to make sure that she is given the platform to continue this incredibly important work.
And I'm really inspired by the role Women Deliver has played in giving a place for young people. I'm one of over 1,000 youth delegates here at Women Deliver in 2019. And I think it's really important to provide young people with the platform to really advocate for themselves and for the health of their communities.
And it's been so wonderful to see that on each panel, Women Deliver has had a youth representation because their voices have been amongst the most powerful we've heard here.
I think the power of we speaks to the power of collaboration. We know at Last Mile Health that we are dedicated to ensuring that the over 1 billion people living in remote communities that currently lack access to care can have access to a trained and professionalized community health worker. But we also know we can't do that work alone. We need the partnership of many, of our collaborators, of the private sector, of the social sector, of our philanthropist partners, and we can't change these large-scale social problems without working together as a collective we.
You have said it, and I will add that I think the we, very importantly, includes women in the we, because it is very easy as you're dealing with people that you're collaborating with for it to be male-dominated. And I think we implies, for me, that at every level we are making sure women are engaged.